Vaccine vial monitor is for to know the exposure of the vaccine uh, to high temperature, and its marker of a cold chain maintenance of vaccine, and indirect marker of the potency of vaccine. And by a vaccine vial monitor, we will get to know like which vaccine we have to use or not, or which vaccine we have to discard, like which we have to vaccine is expiry or not. Means when if the vial the inner square color become dark like blue or dark purple, then it indicate the we have to discard the vial and we can't use the vial. Primary case is the first case of the disease uh, in community, and the index case is the first case which come to notice of investigation. And the incubation period is the time interval between the uh, entry of the organism in human till first sign or symptom. And the quarantine is the limitation of the freedom of the movement of 12% till incubation period of the disease. DALY. It indicates disability adjusted life year, and the best indicator of it is the best indicator of disease burden in the society. And it is the year loss due to the disability and premature death of the person. Epidemic means a large number of the people suffering from the same disease at the same time. And endemic means a constant presence of a disease. And pandemic pandemic means country to country spread of the disease. And QSOFA. QSOFA indicate quick sequential organ failure assessment. It include respiratory rate more than 22 per minute, and mental status, Glasgow score, and systolic blood pressure, hypotension, less than 100 mmHg, and score more than two criteria indicate the high risk of the organ damage or poor and high risk of a poor outcome. Neonatal mortality rate. The neonatal mortality rate is around 24, uh, means 24 death per 1000 newborn. And the most common cause of the neonatal mortality rate is prematurity and low birth weight. And maternal mortality rate, currently the value is the 103 per 1 lakh. And the most common cause of the maternal mortality rate is postpartum hemorrhage.